happens when pregnant women are given a COVID vaccine? The government said it was experimental at one time. The COVID-19 vaccine. Not only is the woman anxious about how it affects her, but the baby too in the long term. Well, medical researchers were concerned too, and they continued to study the effects. Joining us this afternoon is Dr. Greg Marchand of the Marchand Institute for Minimally Invasive Surgery. Thank you so much for being with us.
Thank you for having me. It's a pleasure to be here.
Read up on you, and you have some good news, at least the short-term study, about what the effects have been on moms and babies.
Absolutely. We're so excited that this was just published in Nature's Vaccine Journal. This is the largest study so far looking at the safety and the efficacy of vaccines in pregnancy, and it's mostly good news. As you've already pointed out, we're really just looking at the short-term safety. We don't have the long-term safety yet, but for the short-term safety, meaning during the pregnancy, we're not seeing any major safety concerns. We're seeing a slight rise in cesarean sections for women that receive the vaccine, but other than that, no rise in maternal deaths, no rise in stillbirth, and we're seeing the vaccine seems to be pretty efficacious. It really seems to work well in preventing the COVID, contracting COVID during pregnancy and in the postpartum period. So far, so good.
And that information is just a relief for so many persons. I did have a baby born, a grandchild, not me personally, a grandchild during then, and that's good information. Now, do the statistics give you any idea why there was a slight increase in C-sections? Was that revealed yet?
No, we actually don't know exactly why women who received the vaccination were more likely to have C-sections. We're going to continue studying this. Several theories that have come up. Some people have, some researchers have suggested there could be some effect of the vaccine on the placenta that requires a C-section, or that makes the OBGYNs that are taking care of these women think a C-section might be necessary. Another possibility is that there's a bit of bias here, meaning that the women who are deciding to get the vaccine are more likely for other reasons to decide to get a C-section or to electively choose to have a C-section. So those are the two main factors that we're looking at. But no, I don't have a definitive answer as to why the C-section rate was higher in vaccinated women.
Okay, and I hope I'm not putting you in a situation, because I wanted to know, I do want to know, what about the long-term effects? You study numbers. Do you have any idea how a woman who had a baby during the pandemic should be looking at the development, or how do you face the long-term possible effects?
That's a scary question, but a very good question. We just don't know is the short answer. I can say so far so good. There's no short-term complications, not seeing stillbirths, not seeing maternal deaths. But you're right, things that wouldn't show up till longer term, things like childhood cancers or autism. You know, we just don't have any data on that. But I can say so far so good. We haven't found any problems yet, and I'm certainly hopeful for the future that we're going to find out that this was mostly safe.
Dr. Marchand, may I say too that I think that not only is my grandbaby healthy, she's probably the prettiest baby ever born. You know, so I just had to get that in there. And I hope our mama is watching. Yes. Oh, wow. Do you think that it's okay then for pregnant women now to take that COVID shot? Is it even being requested of them?
Well, there's actually more data now to say, from our study, there's a lot more data to say it is safe. But I still think for every pregnant woman, it's a decision that has to be made between her and her obstetrician. In every case, you've got to individually look at the risks and the benefits. There's still a lot of cases where these unknown risks in the future are going to mean it's just a little bit too much of a risk to take that chance, especially for young, healthy mothers. But that's a decision to be made between the pregnant woman and her obstetrician. And you really have to weigh each and every patient on an individual basis. There absolutely is no one size fits all. Everyone needs it or everyone doesn't need it answer.
Thank you for being with us, Dr. Greg Marchand.
Thank you so much for having me.